Hi, Atul Kamath. I wanted to address an important question I commonly get in the clinic. It's, when is it time to pursue joint replacement? I wanted to discuss 7 key factors you may want to consider before making this very important decision. So, deciding whether to pursue hip or knee joint replacement surgery can feel overwhelming. Many individuals experience hip or knee pain, but the reasons for considering surgery differ from person to person. It's vital to evaluate your personal situation, assess your pain levels, and think about how your joint problems are affecting your daily life. Hip and knee pain can affect your brain as much as your body, so it's important to understand all these factors from pain to functional limitations. And understanding if it's time to consider joint replacement often involves a combination of different factors. Here again, I want to explain and explore 7 key considerations to discuss with your orthopedic surgeon as well as your loved ones when considering joint replacement surgery. So, number 1 is the nature of your pain. To start, assess this nature of the pain. Are you dealing with moderate or intense hip or knee discomfort that disrupts your everyday activities? Or do you suffer from ongoing knee pain that makes even walking feel impossible? If your pain is severe and constant, regardless of whether you're active or resting, it may suggest the need for surgical options. For instance, individuals with severe arthritis may report pain levels reaching 8 out of 10 on a scale of 0 to 10, making essential tasks like climbing stairs or getting out of bed difficult. Another factor, number 2, is the impact on daily activities. Consider how your joint issues affect your daily life. Are you relying on others to help with basic activities like shopping, cooking, or even getting in and out of a car? This dependency can greatly reduce your quality of life. Research shows that nearly 60% of individuals with knee osteoarthritis report struggling with routine tasks of daily living. If you find yourself needing assistance for these activities more often than you'd prefer, this could be a sign to consult a joint replacement surgeon. Number 3 is treatment outcomes. Before heading for joint replacement, it's likely you have already tried various non-surgical treatments. This could include oral pain medications, physical therapy, or injections like steroid injections for pain. If you're still experiencing significant discomfort, it may be time to consider your treatment options and take it for surgical opinion. For example, if your experience with supportive devices like a cane or a brace has been disappointing, make sure to discuss this with your healthcare provider as it may help clarify your need for surgery. The next factor to consider is the level of inflammation and swelling. The presence of inflammation and swelling in your joints is another all-important factor. Are you witnessing noticeable swelling in your hip or knee? Are you also experiencing any joint deformity? Many people undergoing knee or hip replacement report chronic swelling that does not improve with conservative measures. In fact, studies indicate that around 70% of potential candidates for joint replacement show some signs of significant joint inflammation. So consulting with a hip and knee specialist can provide clarity on your situation and its future implications. Another factor is pain management and how efficacious it is. Everyone experiences pain differently. Recognizing your body's response to treatment can provide essential insights. If pain persists even during rest, it may indicate that non-surgical measures are no longer effective. This knowledge can be pivotal when discussing your case with an orthopedic expert, as it will help them understand the urgency and the impact of your condition on your quality of life. Another important factor is physical therapy limitations. Physical therapy often assists in relieving pain and restoring mobility. I try physical therapy with the majority of my patients. But if you're participating in therapy without improvement, it may signify a need for more approach that involves addressing the underlying cause of the arthritis. Severe arthritis can sometimes hinder patients from even engaging optimally in therapy sessions. If you find that pain makes it difficult to partake in physical therapy, or sometimes physical therapy makes the pain worse, this may signal that surgery could be your best option to return to an active lifestyle. Your orthopedic surgeon can evaluate the potential benefits of this situation and how your response to physical therapy has been. The final factor, and perhaps the most important, is what I would call the mirror moment for pursuing joint replacement. Many individuals have what I would call this mirror moment where you look in the mirror and you say, listen, it's time for the replacement. This is a time of self-reflection when you realize their quality of life is no longer satisfactory. If joint pain is causing you to withdraw from social activities and you see your lifestyle changing, it's time to explore these options. So reflect on the things you've once enjoyed. For instance, if weekly hiking trips with friends have dwindled due to pain, it's critical to consider consulting a specialist sooner rather than later. As you consider the factors discussed, the 7 factors, decide when to pursue joint replacement may become clearer or help you form guide rails or guidelines to pursue joint replacement. Of course, this process may feel complex, but you're not alone. Many individuals have faced similar crossroads and found relief by opting for surgical intervention. So don't hesitate to seek advice from family and friends during this decision-making process. Consulting also with an orthopedic hip and knee specialist can also help you tease out the decision to pursue surgery. Many individuals who delay their decision often say that they had wished they had pursued surgery sooner, given the significant pain relief and functional benefits from the surgery. So gather your thoughts, write them down, weigh these factors, and then consult a hip or knee specialist. Taking action can lead to improved mobility, pain reduction, and simply better quality of life. So your journey towards joint health does not have to be made alone. Consider these factors, discuss these with loved ones and close family and friends, and with the right support and resources, you can confidently choose the best path to your health and happiness. We'll see you soon at Came with Orthopedics.